Hi, my name is Vanessa Jasuja, and today I'm going to be talking about Kabwe, Zambia, and more specifically, the effects lead contamination is having on the population. Every day, children in Kabwe are being poisoned by lead due to the previous mining and smelting. Although the mines have been closed since 1994, the effects are still being seen today. This is caused by traces of lead in the soil and sand, which then gets transferred to the clothes, buildings, and mouths of children. These children are presenting with high blood lead levels, also known as BLLS, along with other symptoms that are impacting their development. Some of these symptoms include organ damage, stunted growth, learning difficulty, blindness, and even coma or death. One thing researchers have found is that there is a strong correlation between high lead levels and children. It is believed that this is the result of children inhaling and consuming soil while playing. Parents of children attempt to combat this by frequently washing their children and their clothes. Children whose blood lead levels are over 45 micrograms of lead per deciliter of blood are recommended to get chelation therapy. Throughout this video, I will answer if these treatments are actually successful and effective. Full of contents. In this video, we will be going over 5 key points. The first being lead concentration in the topsoil and subsurface soil. Second, age distribution of children with high blood lead levels. Third, blood lead levels of children in different townships. Fourth, the mortality rates as age progresses. Fifth, the effects of treatment for lowering BLL. Following that, we will have a summary page and the references. Table 1. This first graph shows us the lead concentration in both the topsoil and subsurface soil in Kabwe. This graph shows us that the lead levels are higher in the soil closer to the smelter, where if you look on the graph on the right, the smelter is right over here, and the places closest to it with the highest levels of lead concentration are represented as this darker red area, and the lead levels decrease the further away you get from the smelter, which is represented by these green levels over here. 3 towns that this video will refer to and focus on are Makululu, which on the left is right here, and this is in an area of yellow. Kasanda, which is in an area between the yellow and the orange, and Chawa, which is in a green area. Table 2. A study done by the International Journal of Science took a sample of 1,166 children from those 3 townships. All these children had high blood lead levels, and this study found that children of the age 5 and up were more likely affected. This is most likely due to children having more mobility and therefore a higher risk factor in terms of playing in the lead-contaminated soil. The breakdown of the distribution is that ages 1 to 2 was 303 children, 3 to 4 was 355 children, and 5 and above was 508. Table 3. The International Journal of Science also measured the blood lead levels in that same sample of children. They wanted to see if the blood lead levels varied depending on township. We can see that Chawa, which on the graph is represented by the blue bar, had the lower levels of lead in their blood. This data is supported by Table 1, which showed that Chawa also had the lowest lead levels in their soil. Kasanda, which is represented by the orange bar in the graph, has higher lead levels compared to the other 2, which makes sense since their soil lead concentrations were higher. Table 4. In Table 4, we see the distribution of mortality rates between neonatal, postnatal, and child mortality for every 1,000 live births. Neonatal is described as the first 28 days of life, while postnatal is the range between 28 days and 12 months, and child mortality is the range of 12 months to 59 months. Generally, as the years go by, the rates decrease. This graph shows us that regardless of the year, whether it be 1992, 1996, 2002, or 2007, child mortality rates are always the highest. This once again supports the idea that lead in the soil is causing lead poisoning. Since older children have higher risk factors and therefore are more likely to be exposed to it through soil, compared to younger babies. Table 5. This last graph shows the results of a study that wanted to test the effect lead treatments had on children. In this study, 5,000 children were treated with chelation and nutritional supplements. As a result, 2,822 children showed a reduction of lead levels in their blood after completing treatment. One thing to keep in mind and notice about these graphs is that data from CHOA in 2009 was unobtainable and therefore is not represented on this graph. Summary. To this day, children are still being exposed to lead, and they will continue to be exposed unless there is a comprehensive cleanup done. These graphs have shown that children are more susceptible to lead poisoning due to their risk factors such as playing in the soil, accidentally inhaling particles, or consuming the lead particles in the soil. The good thing is that steps to clean the towns have already begun, and children as well as adults who need health care are slowly gaining more access to it. Here is a list of references used throughout this video, and thank you for watching.